Welcome to NU 555, Module 1, Why Manage Health Data. I'm Christina Clark with the University of South Alabama. In Module 1, I chose Option 2, which is to make a video for patients at a clinic with the goal of explaining some of the main benefits they will enjoy when the clinics fully implement electronic health records and connect to a health information exchange, an HIA. The Center for Medicare and Medicaid Services has an office, and the office is called the National Coordinator for HIT, Health Information Technology. This was developed for the purpose to promote a national health information technology HIT infrastructure and oversee its development. The Office of the National Coordinator, ONC, is part of the U.S. Department of Health and Human Services, used to develop rules that enhance surveillance and transparency of health information technology. CMS, Center for Medicare and Medicaid Services, has learned that shifting the focus from paying for just the volume of patients a provider sees, or paying physicians a fee for their services, to paying them for their patients' outcomes, your outcomes, delivers a more valuable service. In order to accomplish this goal, the outcome needs to be measurable and reliable across all care providers. This can be accomplished by using the electronic medical record. The focus of ONC is the patient. The focus is you. The goal is giving patients the very best care and giving it consistently. Let me give you an example of concentrating on better outcomes. Did you know having high blood pressure puts you at certain health risks? Did you know a lot of people do not know what their blood pressure is? By having electronic health records, reports can be generated from patient health records in meaningful ways, such as determining if blood pressure control has been maintained. Evidence has shown that maintaining a blood pressure of less than 140/90 improves outcomes for patients, such as lowering risk of stroke and heart attacks. The United States Preventive Services Task Force, 2007, recommends screening for high blood pressure in adults age 18 and older. There is a real-life story that a nurse who once asked a patient how long they have had high blood pressure. And the patient responded that they did not have high blood pressure. And when the nurse asked them, well, why do you take Atenolol and Zestrol? The response was, oh, that is so I don't have high blood pressure. So the purpose of changing providers' payments from fee-for-service to outcomes is so the provider will transition the care they give to evidence-based practice. Typically, in fee-for-service, a doctor may be content with a blood pressure of 140/90, stable labs, no complaints from the patient, and just see them back in a year. So you see, some patients think that they do not have high blood pressure because the medication their doctor put them on cured them. But in today's age of electronically reported outcomes of care, a patient with a blood pressure of 140/90 would be seen in 3 months and have lifestyle, nutrition, and exercise discussed with them. The electronic health record gives doctors the ability to monitor trends, such as blood pressure being controlled. Data from the electronic health record provides information that helps your doctor deliver better care. Under ONC's Meaningful Use program of the electronic health record, blood pressure control is one of many health indicators that can generate a report that pulls data into meaningful information. This information allows doctors to see trends in the care of their patients, which will allow them to provide evidence-based medical care to you. There are a lot of benefits to your doctor. There's benefits to the laboratory, radiology, healthcare specialists, all being able to see just one medical record, which is the Health Information Exchange, HIE. Your healthcare providers are able to collectively collaborate on your care safer and more efficiently. But that does not mean that the computer is more important than you. Patients will have access to patient portals through email addresses. So if you want to access your records, you will need to let the front desk know what email address they can use. Once you are registered, you go online and look at your own healthcare information. The goal is for patients to be involved in their own care and be knowledgeable. Eventually, you will receive reminders about your scheduled appointments by the Telebox, which sends text messages to your smartphone as a reminder. By optimizing the EHR, workflow can be adjusted to assist the clinics in identifying patients that need alert for preventive screening, such as immunization screening, breast cancer screening, screening for diabetes, depression screening and follow-up, colorectal screening. Very, very important to your healthcare. For certain populations and cultures, the clinical documentation can be done outside of the room, so that the EHR is only used for a tool to educate patients for needs such as diabetes, nutritional care, and blood pressure monitoring, to name a few. At times, you may feel like your doctor is more focused on the computer than on you. You'll only feel that way for a short while. Some doctors work very well with computers and will find the learning curve easy, and for the others it will not be so easy. But over time it will get better. And the potential for better health outcomes is very important. It will take some time uploading historical information into the computer and current information. So you may be asked a lot of questions, some of them repeated by different people, such as the front desk, billing, the nurses, and your doctor. Please know that even though there may be a computer between you and your doctor is working long hours to overcome this challenge and spending more time looking at information, sometimes late into the night, to double check on your care. Once all of your doctor's patient's information has been uploaded, the data will be validated and secured, and patients will have the ability to access their own information and be partners in their care. Thank you very much.